Hello, everyone. Joe Ramira and classmates. For this week's oral soap note, I will be covering an OBGYN case. For this week, it is gonna be Miss AM. Those are her initials. Her date of birth is 1/21/1991. She's a female and she's Caucasian. Miss AM came into the clinic with complaints of bumps to her vaginal area, which she noticed 7 days ago when she was urinating. At the moment, she denied any fevers, any chills, or any pain, or any itchiness to the site. She's not currently on any treatments, but she does use warm compress to alleviate some of the discomfort. At the moment, her pain is mild. She states a pain scale of three to 10 on the pain scale. She is not currently on any medications. She has no known drug or food allergies. She does not have a previous medical history, and she also denies any previous hospitalizations or any previous um, surgical history. She states her menarche started at the age of 13. She has regular menstrual cycles. Her last menstrual cycle was on November 5th of 2021. She states she started being sexually active when she was 20. She's had multiple partners. Um, she cannot specify how many partners at the moment, but she does mention she's been sexually active since she's been 20, with multiple partners again. Her social history: she's currently single, does not have any children. She says she uses alcohol and tobacco occasionally, but denies any illicit drugs. She says she's up to date with immunization. She received all her immunizations since she was a child, and she also mentions that she receives a yearly influenza vaccine. She currently lives with her mother. I'm sorry, with both parents at home. Her mother's generally healthy. Is diagnosed with hypertension, and her father is diagnosed with hyperlipidemia. And she also mentions that she is a teacher, a middle um, a middle school teacher. Review symptoms: generalized, denies any recent weight loss or weight changes, no fevers, no weakness, denies any headaches, postnasal drip, rhinorrhea, no vision problems, no hearing loss, no sore throat, no sinus pressure or difficulty swallowing at the moment. Denies any neck stiffness or decrease in range of motion to neck. Breast, there's no pain or any lumps. Respiratory, denies any shortness of breath, denies any cough, no sputum or production, denies any chest pain, palpitations, or edema, denies any abdominal pain, no nausea, no vomiting, no diarrhea, no blood in the stool. The moment denies any burning sensation. She also denies any pain or stiffness to the joints, denies any fractures. She denies any suicidal ideations. She mentions she tends to get a little anxious, because she mentions that her job might be somewhat stressful, but she doesn't mention the anxiety to be severe. Um, no headaches, no syncope, no numbness or tingling sensation to the extremities. She does when it comes to her integumentary system, she does mention those bumps in the vaginal area. She says that they're soft and they're located on the right side of her labia. She denies any abnormal bleeding or abnormal bruising. She denies any cold or heat intolerance, no polyuria, polydipsia, and no respiratory problems or any or allergic rhinitis. Upon physical assessment, temperature is 98.4, orally, pulse is 88, blood pressure is 118/64, O2 sat 700 at room air. She is 62 inches tall, and she weighs 133, and her BMI is currently at 17.1. Upon her general appearance, she's alert oriented times 4. She is well groomed and neatly dressed. No swelling or edema to neck, no lymph nodes enlargement, lungs are clear to auscultation, non-labored breathing, no murmurs, normal S1 and S2. Upon her assessment to the general area, to her vaginal area, she does have two painless papules, soft papules to the right side of her labia majora. She didn't have any tenderness or any discharge. Upon assessment again, I currently am gonna my primary diagnosis at the moment is gonna be genital warts. My differential diagnosis will include genital herpes and syphilis, and my primary diagnosis being genital warts. Diagnosis tests will be biopsy to the side of the papules. A physical examination of genital warts includes a soft, smooth papule to vaginal area. I will also do a pap smear, HPV test as well, and again, her sexual history will be included in the diagnostic. The plan for the moment will include Aldera medication and some ointment to treat the genital warts, and trichloroacetic acid chemical used to burn off the genital warts, cryotherapy as well to freeze and remove the warts, and if needed as well, surgical excision. Education again for this patient is going to include abstinence at the moment. Um, Report any further breakouts similar to those as mentioned, soft papules or cauliflower-like formation in her vaginal area, as well to um, let her partners know about the her current health condition, and I would like to follow up with her in about a month if the breakouts are not alleviated or if the worsening of the condition continues. I would like to see her in 4 weeks. And yeah, that was it for this week's oral soap presentation.